South Africa only recorded its first infection 2 weeks ago, but there are now more than 100 cases and counting. Researchers say it's the start of a very serious epidemic. Some are calling it a time bomb because of the levels of disease and poverty in the country. More than 7 million people here have HIV. Many of those also have tuberculosis, and more than 5 million people live in informal settlements in shacks without running water on tap. The government fears that the virus will spread like wildfire in these areas where people cannot self-isolate. President Cyril Ramaphosa has declared a national disaster. He's closed schools, Parliament is closing, and there are strict travel restrictions in place. This was a logical step because the first infections were all in people who had recently returned from high-risk areas, but there are now more than a dozen cases of local transmission. This is of great concern to the health minister. He's trying to establish how these infections occurred. Because he's fully well aware that there are not enough beds in public hospitals, and there's every risk that the public health system will be overwhelmed long before any of the forecasts become reality.